role that I play in the hospital is I'm a quality and process improvement nurse, where that means I help with different kind of quality initiatives and improvements, working with different compliance agencies, state agencies, regulatory bodies. And now I'm actually transitioning to becoming a senior compliance analyst, where I'll be actually doing some deep dives and really getting to be the backbone and the behind the scenes of healthcare and insurance plans that people don't really know about. I think having the nurses' voices be valued is pivotal and vital to any success of transition and transforming of healthcare. Because let's be honest, I know like everyone is, chipping and pitching for the providers, but nurses are there 24/7 in different aspects. We're seeing all different kind of clinical outcomes with our patients. So we are the champions of how healthcare will transform. And I think once that shift turns, and it's, we still want our providers' input, of course, but the people who are pushing out these initiatives and pushing out these cares are coming up with the innovation are nurses, and also in other areas of healthcare as well. But I can say that nurses should be the main focus when it comes to like big organizations like this or big conferences like this, because we are no longer at the bedside. We are on committees, we are on councils, we are advocating in the community, we're advocating across the world. So this is where we know that our voices are needed and must be heard in order to transform health globally, not just locally. I believe the patient experience is very important, especially when it comes to technology. They can be the advocates of their own health through technology. I think the mindset of, the hospital being the main place, now it's completely opposite. Your consumers are the patients, and they should have a say-so in how they want their health delivered. And now that we're in this diverse realm of technology, our patients want to be more engaged through that way, through devices and technology that can help them be more tuned with their health. And for nurses, that's what we do all day, every day. So nurses should be more engaged as well in the technology. So we're the educators of these devices, and we're encouraging and teaching patients how to use the device or use the technology platform to its best ability for their own successful health care. My ultimate mission and goal is to reduce the shortage and burnout of nurses. And I say this because I was once at that stage where I just was like, nursing isn't for me. Let me go into another field, marketing, digital health. And that's when I realized that no, the more that we continue to run away from the problem and not find a solution is when the issues become so big. And of course, tons of research and studies are showing that, in a couple of years, we're going to be in an extreme shortage of nurses. So using my platform to interview other nurses, especially millennial nurses, especially diversity, and showing them different avenues of nursing, just like seasons change, so can your career in nursing. You can start off at the bedside, then you can move into administration, you can go into digital health, you can go into occupational health, community health. It's just vast opportunities for nurses. So I'm using my platform to help decrease the shortage and burnout. So having nurses know the other areas they can go into as seasons change in their life, so can their nursing career.